They are full of blood, the pressure is high, and at this second, your papillary muscles have pulled those AV valves shut. It's just a split second, and then the pressure is so high, the semilunar valves are now pushed open just like trapdoors, and the blood goes where?
Into the aorta and the pulmonary.
Good. Out through the aorta and through the pulmonary trunk. So now it's rushing out of the heart, and blood, of course, is going to go over to the lungs, and then, of course, through the aorta, we're going to go out to the body. So there's that brief split second where you have all four valves shut, and, of course, this is in the area called systole or systole, and at this point we have high pressure in the heart as blood is being injected from those two ventricles. All right. Now, after blood passes through those semilunar valves are standing open, and then they're going to slam back, boom, shut, right? That's the second sound in our heart sound, that lub-dub that we hear of a heartbeat. The first sound is the AV valve slamming shut. Now the second heart sound are those semilunar valves slamming back shut. So they have different noises because of the shape of the valve and how quickly they slam shut. But that lub-dub sound, the heartbeat noise that we typically attribute to our hearts beating, is actually, in fact, those valves slamming shut. Now, this is a second time that those heart valves are all shut together at the same time. And if you flip over to the top of page 44 with me, at the very top there it says early diastole. It's called isovolumetric relaxation. Isovolumetric relaxation is now the second time that you have the heart valves all closed. Okay? So let's differentiate the two. Isovolumetric relaxation because the heart just did what?
Pump the blood.
Just pump the blood out. Is there any blood sitting right now in those ventricles?
A little bit.
A little bit. How much did you pump out of each ventricle? About 70 milliliters of blood. That's what we call stroke volume, because with each stroke, we're going to pump out 70 mils of blood. That leaves us with 50 mils of blood. So at this point, the heart is not entirely empty. There is a little bit of blood in each ventricle, but at this point, we do say the heart is entering its relaxation phase, a period that we call diastole. So you notice that we are entering again early diastole. We're coming back to a point where the heart is relaxed, and now we'll start to fill with blood again. Alright, so let's go back and talk about the two times the heart valves are closed. The first time those heart valves are closed, we call that isovolumetric what? Contraction, because the heart is entering a point of contracting, right? And during that point, all four valves are shut, and we're getting ready to pump blood up and out of those two large arteries, aorta and the pulmonary trunk. The second time those four valves are all closed at the same time is after the heart has ejected the blood from the ventricles, and now we're starting to enter a relaxation phase. So there's two brief periods during heart contraction and heart relaxation where you actually have all valves shut at the same time. I want you to notice something. We have not mentioned any point at which all four valves are open at the same time. We've only mentioned two brief seconds, milliseconds they are, in which all four valves are closed at the same time. So there are two brief periods there where we do shut all four valves up. What this actually does for us is it ties together diastole and systole, which are the heart relaxation and contraction phases, with blood pressures and also with the movement of blood through those heart valves. So we're actually talking about three separate things right now. We're talking about how the blood travels from high to low pressure. We're talking about how the heart valves regulate that flow. And then, of course, we're assigning a name, diastole to relaxation, and then systole to contraction. So if you're confused, separate it into the three events so you can see that the blood flow is one separate event. The regulation of the blood flow through those heart valve activities is a separate set of things we're concerned about. And then, of course, naming it diastole versus systole. So you can actually separate it and talk separately about those three activities. All right, so that's a lot of heavy-duty material. How about questions so far?
You just talking about the blood, when it's 70 mils of blood. When is it 70 mils of blood?
When is it 70 mils? when you're contracting the two ventricles, you start with 120 mils in each ventricle. That's at the beginning of the contraction. Boom, pump out 70 mils from each ventricle, and then what you're left with in there is 50 mils sitting around waiting for the next event to bring blood down in there. So during systole, that's when you pump out 70, and that's when you're left with 50. Okay.
So for isovolumetric contraction, all four valves are closed.
Right.
Blood is in the ventricles. Is there any blood in the atria?
There's some draining back in, but it hasn't been pumped into the ventricles yet. Okay. So you're right. Isovolumetric contraction phase, blood is filling the ventricles. All four valves are shut right now, and then we're getting ready to pump the blood up and out through the aorta and the pulmonary trunk. After that blood is pumped out, we have only about 50 milliliters of blood left in each ventricle, and again for a brief second, your semilunar valve slams shut. Notice your AV valves are still shut. This is now what we call isovolumetric play. Relaxation. So isovolumetric contraction says we're getting ready to contract the ventricle, while isovolumetric relaxation says we're getting ready to relax the ventricle. So use those terms there to help you predict what's going to happen in each set of ventricles.
So it's during relaxation that it flows to prevent the backflow?
Exactly. Yes.